George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. October is Domestic Violence Awareness Month, and each and every week during the month of October, we've been partnering with Vera House to bring you the services and programs that help you to understand the services that Vera House offers. And so today, our conversation is about elder justice and a brand new $500,000 grant that Vera House, through its Elder Justice Initiative, received to provide some really exciting programs in the community. So, joining me now is Jenny Ackley. She is the director of our Elder Justice Program. And I'm going to have Jenny explain what her title is because it kind of just changed because she keeps adding money to the program. And by the way, full disclosure, as you know, I also work with Vera House, so there's that. We have Sarah Reckes. She is the director for the Center for Court Innovation, upstate New York office. Cindy Davies is a social worker with Christian Community, also part of this program. Also, we have Mary Helen McNeil. She's the director of Elder Health Law at the Syracuse University College of Law. So, over the next few moments, we're going to hear from all of these individuals on the services that they provide and what specifically this grant is going to do with the partnership. And we're talking about restorative justice practices within these buildings. We've got law students who will be in these buildings as well. But also, this is really about elder justice and elder abuse, if you will. And so let's start with you, Jenny, about first of all, what elder abuse is and what the program does, and then let's talk specifically about this grant and how you help individuals who are 50 years and older at Vera House through the services and how the program has grown. Okay, Jenny, it's on you now.
Okay, great. Thank you, George, so much for that introduction. Yes, I'm the program director for the Abuse in Later Life program. And in that role, I kind of look over all of the programming for the elder abuse program and what does that involve. There's a lot of education and awareness that this work was founded on, and we started doing a lot of that work. But over the last about 9 years, we've been really adding a lot to our services. So we've added an elder advocate. That elder advocate works one-on-one with older adults dealing with issues of elder abuse. You asked, what does that include? So elder abuse can be domestic violence for someone who's older. It could be physical abuse. It could be emotional abuse. It can be sexual abuse, just like it can with individuals dealing with intimate partner violence at a younger age. But some of the things that make it a little different is there's things like neglect by someone who is a caregiver. And in almost every case we're looking at, there's some form of financial exploitation that happens
Sure.
of older adults. And one of the other things that is really complicated about the issue is most of this happens at the hands of someone they know.
Yeah.
90% of the time it's a family member. And that's what makes it so complex to deal with, because the person really wants to maintain a relationship with that family member. So how do you ensure safety is maintained? We really want to work one-on-one with these individuals to make sure that we're achieving the goals that they want. So yeah, I'll leave it there.
All right, so program director for abuse in later life, right? Okay.
Yes, correct.
And so this grant then is sort of expanding those services and providing community-based options to respond to elder abuse. All right, so let's expand on that. So now what's this grant specifically going to do?
Yes, we're very excited. We've been working in partnership with several organizations like Syracuse University and Center for Court Innovation. Cindy Davis has been involved with us for years, and we've been talking about how do we start to expand the services. As I mentioned, most of the time it's a family member, and what we know is the justice system doesn't work for everybody. And not very many people want their child going to jail, right? Or want their loved one going to jail. So we really wanted to look for a lot of other methodologies. And what we found in working with a lot of older adults is really they wanted some kind of healing. They didn't necessarily want the money back, but they wanted the relationship back. They wanted to rebuild trust with the person who had harmed them. So we've been talking for years to see how might we embed more of these services in our community to expand and add options so that older adults had a multitude of options. And that's kind of the grounding for this grant that we applied for.
Very exciting, and we should let me just go back for a little bit when you talked about most of the time the a person the abuse, whether it's neglect, financial, even sexual or domestic abuse, is at the hands of someone that the person knows, and that might be the only caretaker that they have, and so putting that person connecting that person to law enforcement might also jeopardize their safety. It's so complicated, and that's why it's such a difficult issue, and that's why your unit has been created to address those specific issues that relate specifically to the nuances and complexities of these issues. A lot of people think this is happening in some building in a nursing home and all of that. And as you point out, most of this is happening with somebody that person knows, a caretaker, of a sibling, an adult child.
And it's happening in the community.
And it's
Yep.
happening in the community. So let's go to
Yep.
the community. And Cindy Davies, you were at Christopher Community, right? It's right in your name. You are part of this team. And what's going to be happening in the 3 buildings that this program is going to be housed in?
Side, George, that have limited staff support. Um, we have a large building that does have a housing service coordinator that's involved. And we also have 2 buildings that only house a manager, and 50 units of people who are trying to live independently in the community. All of our residents are certainly low income to qualify to be in our housing. Many of our housing residents come from diverse backgrounds. They might have some language difficulties. We're seeing a large diversity among these 3 buildings, and that's part of the reason why we wanted to include these buildings in our projects. What I see also as a social worker are that people are relying on family members quite heavily to assist them with their daily living needs, whether it's shopping, going to the bank. Sometimes there are no other alternatives. We try to be creative with encouraging people who might be, if we know that they're being exploited, to have a rep payee or have someone else. But it's very difficult, as Jenny said, for people to want to turn their family members away and not have them as part of their support in living in our buildings.
Sure. And Cindy, on our next go round, I want to have you speak up a little bit more just to get that volume up on your end. But and so yes, and so Sarah, and Mary Helen, this is where you come in because there's 2 sides of it. You're the director of legal project at Syracuse. Or Mary Helen, tell me your title again.
Sure. I'm the director of the Elder and Health Law Clinic at
Thank you.
Syracuse College of Law.
All right, so talk to me about your involvement in this piece.
Okay, sure. So we have for a number of years been providing civil legal services to lower income older people and seen a number of these cases of abuse, whether it's financial, sexual, whatever, and have been looking for an alternative way to address the problems. The civil and criminal justice systems really don't meet the needs of what many older people want. So we together as a group have been exploring the option of providing a restorative process that would bring together the older person and the family member or the friend who's been causing the harm to talk about creating a solution and repairing that relationship. So with this new grant, we're going to be able to work together with the various team members, provide services, and Sarah will talk more directly about the restorative work, but also be a liaison between that work and the clinic at the College of Law, where we can provide supplemental legal services to people who might need them in any of a range of elder law areas, but also to educate students about an alternative way to address this kind of social problem that's not relying on the traditional civil and criminal justice systems.
Right, and that's a significant, that's a significant conversation, especially now in this current environment. And so, Sarah, Mary Helen talked about restorative practices, right? I mean, this is, I don't know, is this is something that many communities are looking to as part of a peacemaking process? Talk to me about this.
Mhm. Yeah, thank you, George. So the Center for Court Innovation runs the Syracuse Peacemaking Project. It's out of the west side of the city of Syracuse. We've been there since 2015, and we train community members in peacemaking, which is a Native American inspired form of conflict resolution and restorative practice. And all of our staff and community members are trained by Native American peacemaking experts from all over the United States. And one of the things that's important to realize about peacemaking is it's about holding people accountable and about healing relationships. If the relationship is worth salvaging, then it's a great case for peacemaking. And so we do a lot of cases where we divert the cases out of the justice system when the justice system is not the appropriate place for that victim, for that offender. I don't really like those terms, but the idea is that what we want to do is we want to provide an alternative. The justice system doesn't work for everybody. It's slow. We get referrals from the Syracuse Police Department, for example, saying we have a neighbor dispute. We could arrest both neighbors, but nothing changes. Both people go back home into their homes and the situation continues. We receive referrals from the Syracuse School District for the same reason. We could suspend this child, but nothing changes. There's nothing restorative about that, right? And so, and we take really all kinds of cases. But over the past 4 years, we've been talking very seriously with the team we have here about what are those alternatives for elder abuse, for people who are experiencing elder abuse, who, like Jenny said, they want to maintain the relationship, but they also want people to be held accountable. And one of the things, we've had some pretty deep conversations with the district attorney's office about what they can and can't do in terms of holding people accountable. And if the victim does not want to prosecute, it's a very difficult case for them to move forward on. And so that's where the question came. What are the alternatives? What can we do? So peacemaking is run by community members. We don't have an expertise in elder abuse, right? And so that's where Vera House comes in. What we want is to be able to provide a restorative option for people, but with the expertise to understand deeply the psychology behind elder abuse, the reality of it, what people are facing within the community. And so what we decided to do is, in partnering with Christopher Community, to embed staff members from the peacemaking program, from the abuse in later life program at Vera House, and from the law school in these buildings to create trust with the people who live there. And one of those pieces of trust is to be their weekly running circles to build community and trust, so that when people begin to disclose, they already have a team behind them. They have a team of community members who are trained in conflict resolution. They have an elder abuse advocate who understands elder abuse and what the options are for them. And they have an attorney, a student attorney, who's ready for them and what their case entails. And so what's really exciting about this project is they give us a lot of time to work on it because these cases aren't fast, they don't go quickly, right? But we'll be able to be in the buildings, embedded with the community, building community every single week with the opportunity to find solutions that work for people who are experiencing elder abuse, rather than us dictating as service providers what they need.
And one of those buildings is directly, it's in our backyard, Villa Scalabrini, one of the buildings, Pompey North and Bishop Harrison House, the 3 buildings that will be where these services will be embedded. And I think it's really, that's really an innovative strategy, right? To have those services embedded where someone can say, this is happening to me, but then have the resources, Jenny, right there in the building that they can take advantage of.
Yeah, and we're just really excited about this because another interesting component of it is it's pilot program. It's research-based. So we're hoping to get findings that we can share really on a national level. What can we find? How is this working? What can we learn from doing this program? And George, in a time of COVID right now, we also know social isolation is like a big risk factor for lots of different things. But one of those things is abuse, elder abuse. So, how can this also impact, reducing that social isolation and building connectedness? So I think from lots of different angles, having people going to the buildings and providing that integrated service is just a really exciting thing for us to be able to do together.
And Mary Helen, this is right up your alley, right? I mean, this is something that I'm sure you're really excited about, and you've seen this work in other spaces.
Yes, absolutely. And my interest in it really comes from, as Jenny referenced, older people saying, I don't want my son to go to jail.
Yeah.
I don't want my daughter to, she doesn't have the money to pay me back, but I want to have her in my life. I want to have a relationship. So it is, as Sarah mentioned, it's a concept that's been tried in a variety of areas, but really only recently have there been discussions about doing it around elder abuse. And we're really excited to be part of a really kind of a new movement to looking at a new approach to address issues around elder abuse.
Supporting people where they are, Cindy. And, one of the things, obviously, that is a major concern and frankly, probably a barrier is building that trust, right? Because, this is, a lot of people may be ashamed to say that this is happening to them. And so there's also that piece of how do you get the residents to feel comfortable enough to say something isn't right? Because Jenny, I would also think that sometimes people normalize behaviors that maybe they shouldn't because of the fact that that's the only support that they have. So Cindy, how do you overcome that barrier?
I think what we've done by having managers in all of our buildings, are you able to hear me better?
Not as good as before, but go ahead. We'll fix it later.
Our managers are certainly key as far as being able to identify people in need. Residents come to our managers, so they have developed a trust relationship quite well with people. They will be very involved with meeting with people and understanding how to involve and engage people with working with a case manager that's hired. They love working, they love meeting with people, with students. They've worked with law students in the past. They've opened up to Jenny in the past when she's come in to do different presentations. So I think building that trust that we have already in place with many of our managers and residents, involving the other collaborative partners to create that trust is going to open up a lot of that information sharing, and again, some creative ways to work together. I'm anxious to involve the Center for Court with developing and having some opportunities for group work with people. People do like to share, and I think as soon as we can work past some of the COVID restrictions in our ability to congregate people together, that will certainly help open the doors to sharing and finding possibly more ways that we can assist our residents.
And finally, Jenny, if there's anything we've left out, let's pick it up here. But how do people access the services? Are they available right now? And what else do we need to know about this program? And I'll give the hotline number for people to start the conversation if they're in need as well.
Great, thank you. So yeah, this project is likely to start in the January timeframe. We have a few months of planning and organizing and hiring and all of that to get things launched and started. So we're really kind of hoping to start January timeframe. But if people are dealing with the issue right now, we still have services that are available. So our elder advocate is available right now who could work with anyone who's dealing with this to kind of brainstorm and see what they want to do. Mary Helen's Elder Law Clinic is already available with students who are able to help if people have some civil issues, and Sarah already has peacemakers. So all of these services exist today. So if people are interested in finding out more or have situations, I would recommend they contact one of the three organizations I mentioned.
And of course, the Vera House can be a gateway to that at our 24-hour support line at 315-468-3260. We also have a chat service at verahouse.org on our website. And these services are free and confidential. And you can even just start a conversation, even if you just have questions, 315-468-3260. And we'll connect you to all of these services that you are looking for. We've had a great conversation today. Thank you so much to Sarah Reckes, Director of Center for Court Innovation for the Upstate New York office, Mary Helen McNeil, Director of Elder and Health Law Clinic at Syracuse University College of Law, Cindy Davies, Social Worker with Christopher Community, and Jenny Ackley, the Project Director or Project Manager, one or the other, for our Abuse and Later Life Project at Vera House. Did I get it right, Jenny?
You got it right. It's good. Thank you so much, George, for helping on this and,
We
and
really
helping us spread the
appreciate that.
word.
Yes, and spreading the word, and we're really excited about what's going to be happening as we expand the services. We, meaning the community, expands its services to support all of our citizens, regardless of their racial or ethnic identity or their income, their ability. These services are available to you. George Kilpatrick, Inspiration for the Nation. Thank you all.
Great. Thank you,
Thank you,
George.
George.
Thank you.